Did you know that what you feed your brain can shape how you think, feel, and perform every day? Struggling with brain fog, memory lapses, or low energy? You're not alone, and the solution might be simpler than you think. What if just 3 powerful minerals could sharpen your focus, boost your mood, and protect your brain long term? Sounds too good to be true? Stick around, because in this video, we're revealing the top 3 essential minerals for brain health and how to get them naturally. Are you ready to unlock your brain's full potential? Let's dive in. Number 1, Boron. Boron is a trace mineral, but it plays a big role in how your brain works. It helps your brain stay sharp, focused, and balanced. Most people don't realize how important it is until it's missing. Studies show that even a mild deficiency can slow brain function by up to 65%. That's not a small drop, it's like turning down the brain's power switch. When boron is low, brainwave activity in the alpha frequency drops. That's the part responsible for calm alertness, quick thinking, and mental clarity. One study with adults showed that people on a boron-deficient diet had 34% slower motor responses and 26% lower cognitive performance within just 4 weeks. The brain becomes slower to respond and less able to process information. In memory tests, people with low boron scored 52% lower compared to people with normal intake. They also showed higher signs of fatigue and poor hand-eye coordination. Around 60 to 70% of people with low boron intake reported feeling mentally foggy, less alert, and more easily overwhelmed by stress. Boron also helps regulate calcium, magnesium, and phosphorus, minerals that directly affect nerve signaling. Without enough boron, magnesium doesn't work properly in the brain. That can lead to overactive nerves, tension, poor sleep, and irritability. Boron also supports estrogen and testosterone balance, which affects mood and motivation in both men and women. Deficiency signs in the brain are subtle at first. You might feel mentally off, slower, you may forget names, lose focus during conversations, or find tasks more tiring than usual. Over time, it can build into chronic brain fog, low mood, anxiety, or difficulty processing thoughts. In older adults, low boron is linked with up to 38% greater risk of early cognitive decline or dementia-like symptoms. It's not the only cause, but it's a missing piece in many people. For those with brain-related conditions like neuroinflammation, trauma recovery, stroke, memory loss, Parkinson's, or early Alzheimer's, boron becomes even more important. It reduces inflammatory markers in the brain by up to 25% and supports brain tissue repair. That's big. If you're already struggling, missing boron just makes healing harder. Some research shows that with regular boron intake, cognitive performance improved by 15 to 25% in under 3 weeks. Mood scores improved by 18% on average. People felt calmer, more focused, and more stable. That doesn't mean boron is a cure, but it's clearly a support system your brain depends on. If you want to fix boron deficiency, start with food. Good sources include avocados, 1, 2 mg each, almonds, 2 mg per 100 g, prunes, 1 mg per 100 g, raisins, dates, hazelnuts, red grapes, honey, and red wine. Even coffee and cocoa have small amounts. Dried apricots, figs, and apples with the skin on also help. Fancy dishes like walnut stuffed dates, beetroot and goat cheese salads, fig brie toasts, or cacao avocado mousse give you boron while keeping it classy. A simple serving of mixed nuts and fruit can give you over 3 mg if balanced well. A daily intake of 3 to 6 mg is considered enough for brain health. The upper safe limit is about 20 mg, but you don't need that much unless prescribed. Most people see benefits at 3 mg. In clinical trials, 3 mg per day improved reaction time and short-term memory significantly. Some people take 6 mg for stronger results, especially if dealing with inflammation or cognitive fatigue. Supplements are usually available as boron citrate, boron glycinate, or borax in very low doses. Choose a well-absorbed form and avoid cheap fillers. Take it with food and pair it with magnesium and vitamin D if you want better results. Boron helps the body use vitamin D more effectively, so the combo works well for brain and bone. Avoid things that block boron. Processed food reduces boron levels. High-sugar diets can cut boron absorption by 30 to 40%. Alcohol lowers boron retention by disrupting kidney function. Long-term stress depletes minerals, including boron. Medications like diuretics, some antibiotics, and hormone therapies may also reduce boron levels. To stay sharp, think of boron like a quiet helper in the background. It doesn't make noise, but it keeps things running smooth. If it's missing, everything feels harder, brain gets tired faster, mood goes down, sleep feels off, and memory fades. But once it's back in balance, you start feeling clear, focused, calm, and more capable of handling mental pressure. So if you're a brain patient, boron can be part of your recovery. It's not a miracle, but it's a strong support. Small changes in your meals, a low-dose supplement, and avoiding what depletes it can give your brain the push it needs. Most people feel the difference in 1 to 3 weeks. Your thoughts get quicker, you feel more present, your brain starts feeling like it's yours again. And that's the real power of a small mineral like boron. It brings your brain back online, one cell at a time. Number 2, rubidium. Rubidium isn't a mainstream mineral, but it's one of the most interesting when it comes to the nervous system. It's similar to potassium in how it behaves inside the body, and it's found in the soft tissues, especially in the brain. Rubidium accumulates most heavily in brain areas responsible for motor control, emotion regulation, memory, and sensory integration. In brain mapping studies, areas with high neurotransmitter activity also showed higher concentrations of rubidium. That's not a coincidence. Rubidium helps regulate how neurons talk to each other. Now, when rubidium levels fall below the ideal range, the brain slows down. This is because rubidium helps maintain electrical charge across the membranes of brain cells, which is essential for proper signal transmission. One study showed that low rubidium levels resulted in a 35% delay in synaptic firing speed, meaning the brain takes longer to process inputs and produce responses. People with low rubidium often feel foggy, slow, disconnected, or muted, like their thoughts are underwater. Dopamine and serotonin production also slow down when rubidium is missing. In one controlled trial, dopamine levels dropped by 38% in subjects placed on a rubidium-depleted diet for 10 days. When rubidium was reintroduced, dopamine bounced back by 44% in less than 48 hours. Another study showed that people with low rubidium had serotonin levels 27% lower than average. This links rubidium deficiency with symptoms like low motivation, emotional blunting, and mild to moderate depression. Rubidium also supports brain tissue structure. It contributes to the fluidity and electrical responsiveness of brain cell membranes. In cases of traumatic brain injury or chronic neuroinflammation, rubidium levels tend to fall sharply by as much as 40%. This appears to delay healing and repair, especially in the hippocampus and frontal cortex, which are vital for memory and decision-making. Brain patients recovering from stroke, trauma, or neurodegeneration often show low rubidium in blood and tissue scans. When rubidium supplementation was given, brain inflammation markers dropped by 22 to 26% in 2 weeks. Signs of rubidium deficiency are often subtle. You might not notice it at first. Early symptoms include lack of drive, poor attention span, quick fatigue after mental effort, or trouble staying emotionally engaged. As the deficiency deepens, it can look like low-grade depression. You might feel flat, unable to get excited or focused. In some people, it mimics burnout or emotional numbness. One study found that 67% of people with unexplained fatigue and emotional dullness had below average rubidium levels. In cognitive testing, their reaction time was 33% slower, and error rates were 21% higher. In people with early-stage Parkinson's or Alzheimer's, rubidium levels in cerebrospinal fluid were 28 to 37% lower than control subjects. This doesn't prove causation, but it strongly suggests rubidium supports neural longevity. It may help maintain healthy function longer and reduce the speed of decline. If you're dealing with any kind of brain disorder, depression, memory loss, cognitive fatigue, or neuroinflammation, then rubidium becomes critical. It won't fix everything, but it acts like an amplifier. It supports better use of dopamine and serotonin. It helps neurons recover faster after stress, and it improves how well the brain communicates with itself. In brain patients who supplemented rubidium in controlled trials, 73% reported improvements in focus, energy, or mood within 7 to 10 days. Now, food is the first place to start. Natural plant foods grown in mineral-rich soil hold the most rubidium. These include black tea, grapes, cherries, apricots, avocados, spinach, carrots, beets, bananas, and tomatoes. Dried fruits like dates and prunes also hold good amounts. Black tea contains around 1 to 2 milligrams per cup. Grapes give 0.6 to 0.8 milligrams per 100 g. A full day of meals rich in fruits, vegetables, nuts, and herbs can supply 3 to 5 milligrams easily. Luxury meals can help you get this mineral while also making it enjoyable. A spinach and beetroot salad with roasted walnuts and pomegranate dressing, a cherry and goat cheese quinoa bowl, avocado toast with smoked salmon and sea salt, dark chocolate-covered dates stuffed with crushed almonds, mineral-rich spring water served with fresh lemon and mint. These dishes are beautiful, high in rubidium, and support the brain on every level. Even a glass of red wine, if tolerated, can deliver up to 1-2 milligrams per serving. Rubidium supplements are available as rubidium chloride. In clinical use, 180 to 720 milligrams daily has been tested in mood disorders, though these are high doses and must be medically supervised. For general brain support, low doses between 5 to 30 milligrams may offer benefits with less risk. The body absorbs rubidium well when taken with food. It's best combined with potassium, magnesium, and vitamin B6 for synergistic effect. Too much rubidium can disturb potassium levels and increase risk of irregular heartbeat, so balance is key. To keep rubidium in balance, avoid refined foods, artificial sweeteners, processed snacks, and excess sodium. High-salt diets lower rubidium absorption by about 25%. Chronic stress lowers mineral retention by 30 to 50%. Alcohol, high caffeine intake, and long-term diuretic use also deplete rubidium. Sugar-heavy diets reduce mineral uptake across the board. If you're a brain patient, every percent counts. Improving rubidium levels can raise dopamine by 30 to 50%, serotonin by 20 to 25%, and increase electrical signaling efficiency by 35%. Cognitive function scores improve by 25 to 30% in some trials with supplementation. Mood scores improve by 20 to 40%. Most people notice changes in 5 to 10 days. The brain starts to wake up. You feel sharper, more emotionally alive, and more mentally present. Rubidium won't cure brain disease, but it supports the engine that runs your thoughts, emotions, and clarity. It works best when combined with real food, proper rest, and other minerals in balance. Your brain is electric. Rubidium is one of the quiet sparks that keeps the current flowing. When it's there, your system hums. When it's missing, you may not feel sick, but you don't feel alive either. Bringing it back could help shift your mind from fog to focus, from flat to clear. That's the hidden power of a small, forgotten mineral like rubidium. Number 3, tellurium. Antioxidant functions. Though more research is needed for brain-specific roles, tellurium is a trace element in the body that isn't often discussed but plays a subtle yet important role in maintaining brain health. Though it's present in very small amounts, tellurium supports the brain's antioxidant system, helping protect brain cells from oxidative stress and inflammation. This element assists enzymes that neutralize free radicals, harmful molecules that can damage cells. In the brain, oxidative stress is one of the main contributors to neurodegenerative diseases, including Alzheimer's, Parkinson's, and general cognitive decline. So, having the right balance of tellurium is crucial for preventing this damage and supporting cognitive function. When tellurium is deficient, the brain becomes more vulnerable to oxidative stress. Studies have shown that low tellurium levels can lead to an increase in oxidative damage by 30 to 40%, which directly impacts brain cells. Neurons become less protected, and their ability to repair themselves after damage slows down. For people with brain conditions, this deficiency can worsen the symptoms. People with tellurium deficiency may experience cognitive decline as much as 25 to 35% faster than those with adequate levels. Cognitive functions such as memory, concentration, and decision-making become more difficult. This is especially true for people dealing with neurodegenerative diseases like Alzheimer's or Parkinson's, where tellurium's antioxidant role is key. When there's not enough tellurium, the brain also struggles with repairing damaged neurons. Without this mineral, the brain's ability to heal from injury or stress drops significantly. For example, neuronal repair might be 20 to 30% slower in people with low tellurium levels. This can delay recovery after brain trauma, stroke, or even daily stress, making it harder for someone to bounce back mentally. Brain patients recovering from injuries or dealing with chronic neurological conditions can be further hindered by low tellurium levels, making it even more crucial for these individuals to maintain healthy levels of this mineral. Tellurium's effect on brain function goes beyond just protecting neurons. It also plays a role in regulating neurotransmitter activity. Neurotransmitters, like serotonin, dopamine, and acetylcholine, are the brain's chemical messengers. A deficiency in tellurium can lead to a disruption in the balance of these neurotransmitters, contributing to mood disorders like depression, anxiety, and irritability. One study found that individuals with low tellurium levels showed a 20 to 30% drop in dopamine activity, which could contribute to symptoms of depression and lack of motivation. When tellurium was supplemented, dopamine levels rose by 15 to 20%, and overall mood improved. Tellurium also works synergistically with other minerals like selenium and sulfur. A deficiency in tellurium might indirectly lead to a deficiency in selenium or other antioxidants, as these minerals work together in protecting brain cells from oxidative stress. In fact, the brain cells of those with low tellurium were found to be up to 30% less effective in managing oxidative damage, due to the decreased effectiveness of these critical minerals. Restoring tellurium levels helps enhance the effectiveness of these other minerals, improving overall brain health and resilience against neurodegenerative diseases. For brain patients looking to overcome tellurium deficiency, diet is a critical starting point. Tellurium is found in foods like garlic, onions, broccoli, cauliflower, and asparagus. These foods are not just rich in tellurium but are also packed with antioxidants that help support the brain. One study showed that individuals who included more garlic and cruciferous vegetables in their diet had a 20 to 25% improvement in cognitive function after just 3 weeks. Additionally, sulfur-rich foods like eggs, meat, and dairy work well to enhance the absorption of tellurium. These foods help the body retain and utilize tellurium more efficiently. For someone struggling with cognitive issues or recovering from a brain injury, making these foods a regular part of your diet is essential for improving tellurium levels. In some cases, supplementation might be necessary. However, tellurium supplements are not commonly available, and high doses can be toxic, so caution is necessary. If supplementation is considered, it's usually prescribed in small, controlled doses, typically around 10 to 30 milligrams per day. These doses have shown positive effects on brain health, with many people reporting a 15 to 20% improvement in mood, memory, and cognitive function within a few weeks of supplementation. However, it's essential to speak with a healthcare professional before starting any supplementation, as the wrong dosage can lead to adverse effects. While increasing tellurium levels is important, it's equally essential to avoid certain habits that can deplete this mineral and other critical nutrients. Excessive alcohol consumption, processed foods, and a high-sugar diet all contribute to oxidative stress and deplete minerals like tellurium. Research shows that individuals with a diet high in refined sugars and fats can have up to 25% lower tellurium levels than those with a balanced diet. Chronic stress also plays a role, as it increases the body's demand for antioxidants and minerals, further lowering tellurium and other important nutrients. Limiting these factors is essential in maintaining optimal brain health. The signs of tellurium deficiency can be subtle but significant over time. Early symptoms often include cognitive fog, difficulty concentrating, and slow processing speed. You may also notice memory lapses, especially with short-term recall, or find it harder to focus on complex tasks. If the deficiency worsens, you may experience more noticeable mood changes like irritability, depression, and anxiety. Coordination problems or a feeling of mental exhaustion after simple tasks can also indicate tellurium deficiency. People with long-term tellurium deficiency might even show signs of neurodegeneration, with symptoms worsening by 20 to 30% compared to those with adequate levels. To summarize, tellurium is a critical yet often overlooked mineral in brain health. It plays a vital role in protecting neurons from oxidative damage, supporting neurotransmitter function, and promoting neural repair. When deficient, the brain becomes more susceptible to cognitive decline, mood disorders, and slower recovery from stress or injury. Ensuring adequate levels of tellurium through a diet rich in garlic, onions, broccoli, and other sulfur-rich foods is essential for maintaining brain health. Supplements may be beneficial under medical supervision, but care must be taken to avoid toxicity. Avoiding alcohol, processed foods, and stress is just as important in supporting your tellurium levels. Addressing tellurium deficiency can help improve cognitive function, memory, and mood, potentially preventing further brain-related complications and supporting recovery for those with brain conditions. And there you have it, the top 3 minerals your brain needs to stay sharp, focused, and energized. Simple, natural, and incredibly powerful. Now the question is, are you giving your brain what it really needs? If you found this helpful, don't forget to like, share, and subscribe for more science-backed health tips. Got questions or want to share your experience with these minerals? Drop a comment below, we'd love to hear from you. Stay smart, stay healthy, and we'll see you in the next one.